You know what frustrates me? This is the amount of paperwork. All this I have to keep up for having my mom on Medicare because my mom suffers from dementia. I have to know all the ins and outs of Medicare. I had to wait till her house was repossessed. I have a guardianship that I've had for not guardianship but a power of attorney from her for the longest freaking time. That I thought when she was going through her mental problems and her dementia that it would allow me to take over bills and sit there and save everything else. Nah, didn't do none of that. I had to wait and let her get put into a facility. Then the facility transferred to a nursing home, and the nursing home had to help me get a lawyer for her power for guardianship of the estate, and or help me to get a guardianship of the person so we can take care of her medical bills. Because staying at the facility that actually takes Medicare costs $12,000 a month. On top of that, we looked into private care, and that's $5,000 a month for the type of care she needs. She gets $2,700 a month between Social Security, her GM retirement pension, and all the other stuff that she gets. And she had life insurance policies. But in the state of Ohio, with our state Medicaid and healthcare system, you have to burn through your pension. You have to burn through everything first before the state will pick up, and then that's your deductible. And that's if you get approved for long-term care. We took us 6 months to get her approved for long-term care with somebody that has dementia, that walks off by herself, that can't remember things, that has memory problems, that needs all kind of medications. It took 6 months going to just get her approved for it. Then it took another 6 months of getting the guardianship for the estate. Now we're working on guardianship of the person, which almost could take a year. Everybody wonder why we have all these homeless people. Most of these homeless people need medical care, or they have mental problems in Ohio. And they can't afford it because most insurances don't cover none of that stuff. Yes, her Medicaid Part Plan A, B, and stuff don't hardly cover that. They want you to go through all these stipulations. They just don't provide care. They don't give you care like this. And y'all acting like, oh, these immigrants are getting these, all right, we're giving them free Medicare to these immigrants and stuff. Have you ever checked out the process of how you actually have to get these healthcare services, what you got to apply for, what you got to do? Matter of fact, let's look at the income requirements. Because, I got to write a spreadsheet out just to figure out what the requirements are. Because you got to understand, you have to, if you're have a dependent just claiming yourself, the poverty level 701, that's what they go off of. Our benefits in Ohio are based off of, you ever heard everybody saying, oh, a good career is paying like $45,000 a year. So they bump you up to whatever the difference is between these two. That's the level of care and federal aid they give you, or whatever, and government assistance and Medicare. That's what they're trying to get you to the level to. And the number changes with how many dependents. So if you want more benefits, you got to have more kids. So you know what? If you have 2 kids, you know what it goes up to? You can make up to $11.95. Now, in our state of Ohio, our minimum wage is $10.45. I have to know these figures. And that also means our state only requires anybody that's being paid flat rate, paid by the mile, paid and stuff, that the only time they can sue their employer for non-payment is if they go below $10.45 an hour. What that means is your employers can pay you up to $13 an hour before they go in minimum wage violation. If you're driving a truck, they only got paid for 19 miles before the day go minimum wage violation. And y'all see these numbers over here are profits that they make per thing. Now, if you put these at the right amounts, our companies can make over $280,000 if they just charge right now, if they pay their employees. And don't think I just come up numbers off my tail. I look all this stuff up. I figure in health insurance. I figure in all the other stuff. I look at wage, minimum wage, hours, rates for different states. I look at how much you got to have for income levels. I look at all this stuff because I got to know all this stuff. There's a whole bunch of figures you can just go out there and look online of what the requirements are, what you get paid out, how much you can make. Because what people forget is to get any of these benefits, you have to be working to get them. The only time you don't have to be working is when you hit retirement age. But then you still have to hit certain income requirements. So before everybody makes all these comments about all this stuff of all these immigrants and all these Haitians and stuff, there's some hardworking people. I've been picking up Haitians and different immigrants that are living in my old apartment. They are making $17 an hour. They are paying $1,400 in rent on an apartment I paid $450 for when I moved out. So tell me how that's right. Because we have a whole bunch of companies around here that are buying up all the houses and they keep jacking up all the rent. The only way you can get cheap rent around here is if you find somebody that's local, that's private, that's got a house that got a reasonable rate. We have a lot of out-of-state investors. So all these people are talking about this is the reason why people don't want to work. Well, you also got to remember this. If you make more money than what those charts say, that's a felony in Ohio, and you get locked up and arrested, and then you got to pay restitution, and then you get kicked completely off the system. So you get no help. You have to find a job that's actually going to actually pay you right and everything else. Yes, we do have a lot of jobs that have been moved to Ohio, and these companies are getting upset because they keep trying to make these daggone laws and keep trying to screw with the system. And they're paying way more than what the federal minimum wage is, the state minimum wage. And now you want to screw with the immigrants that come up here that are working these jobs, because we've lost a lot of jobs in the last freaking 20 years. So yeah. Look stuff up before y'all start making comments.